Thanks for joining us today. Thanks for joining Contagion.
My pleasure.
We're just going to start by asking you a bit about your background in infectious diseases and how your day-to-day has changed since the start of the pandemic.
Well, I'm not an ID specialist. I'm actually an obstetrician. Good thing about being an obstetrician is you're ready for anything changing really quickly. And certainly the pandemic changed everything. Just a little bit about Jefferson. We're right at the epicenter. We're a 14 hospital system here in Philadelphia. We're actually a 3-campus university with 1 campus in Italy. So we got all of that. And we had to get medical students and undergraduate students back and forth. And we have 35,000 employees. So everything that could have been hit by the pandemic was hit. I think one of the things that probably will really resonate with your ID listeners is we have one of our ID folks ran what's called the pan surge when Pennsylvania was looking at what could happen in a pandemic. And because of that, we kept that pandemic disaster drill mentality going for the last 10 years. So when we started, we had about 60 to 70 days PPE on hand, not because we necessarily predicted this pandemic, but we knew that at some point that would be necessary. The simple answer to your question, though, is everything's changed, right? We stopped doing all elective surgery. We have, several different incident command groups. It's a matter of protecting our employees, protecting the frontline folks. We started a Better Together fund for the frontline folks that are now either food or rent vulnerable. We've raised over a few $1 million. Our vaccine center has one of the very exciting vaccines being developed. It's actually based on the rabies vaccine. So it's basically a source component on top of the rabies vaccine. That's very exciting because 100 million doses of rabies vaccine already made a year. So it's not testing necessarily a new vehicle. So we are 100% in the both pandemic vortex, but also 100% in the post-COVID mentality also.
We have to be looking to the next thing, and at the same time, you're right on the front lines of this, really.
Exactly. And look, I think the other thing that we had really been prepared for is we had invested $35 million in telehealth back in 2013. So we had almost unlimited bandwidth in telehealth, what we call healthcare with no address. Because, my background is I've spent a lot of time in Silicon Valley, and I've always felt we should be marrying that Silicon Valley relationship with the traditional healthcare ecosystem. And in fact, some of your listeners might know Hemant Taneja, who was the initial investor in Livongo, Airbnb, Snapchat, a few other things. We have a book coming out together called Unhealthcare, a manifesto for health assurance that starts out as a Silicon Valley entrepreneur and a CEO of an academic medical center walk into a bar and ... What happens when you marry those two worlds? So for us, we were able to literally just turn on the switch and go from about 100 telehealth visits a day. We had 3,200 on Friday. So that's a huge piece. Our telehealth team now calls themselves a Nice Watch, for those of you who are Game of Thrones fans, because they view themselves as sort of the last bastion against the nearly invisible enemy.
That makes a lot of sense. I mean, I definitely recall early on hearing that telehealth could be a really useful tool here, but I mean, to do it on that scale is pretty great.
Yeah, we've also been able to offer it to some other folks that didn't have that technology. Let me just give you an example. And I think one of the good things to come out of this pandemic is a lot of collaboration that didn't exist before. But we have a historically Black college and university called Cheney, and they clearly hadn't had those kind of resources. So we basically just got them all into Jeff Connect. We've done that with some other hospitals that didn't have that. So yeah, we trained within about 2 weeks another 1,500 or so doctors and nurses to be able to use Jeff Connect, which is our telehealth vehicle.
You mentioned the increase in communication between different health systems. Have you found any kind of challenges there based on the way things are set up now that could be addressed in the future for other pandemics? For example, this would just be the kind of thing. Uh, Data collection methods aren't standardized across them, and so sharing information is complicated. Something like that.
Well, look, I think there's going to be a new normal post COVID, and I think we have to recognize that. So much of this doesn't happen because of regulation. I'm not allowed to share a lot of data. University of Pennsylvania is our largest competitor. I since we're the two largest health systems in town, I can't really share. So what are you doing with this insurer? What's your data here? That would be illegal in the old world. I think in the new world, we're going to need different relationships between payers and providers, and providers and other providers. We were in the middle of a merger with the largest non-state-owned safety net hospital. You understand, in Philadelphia, two of our three safety net hospitals have gone bankrupt.
Hmm.
One is 3 blocks away from us that was owned by a for-profit. The other is over near University of Pennsylvania, which was owned by Trinity Health. And the third one was going to merge with Jefferson. Well, the FTC has tried to block that because the traditional thing has been we don't want too many providers getting together, and we're a large system. Well, clearly that makes no sense post-COVID because places won't be able to survive unless they're a certain size. So yeah, I think we will see a positive hangover from the COVID type of collaboration, both between providers and between payers and providers. I've made it very clear to the folks on both sides of the aisle, what we're going to need after this is almost like a 9/11 commission for healthcare. If you think about 9/11, the Democrats blame the Republicans, the Republicans blame the Democrats, but then they got together and said, hey, we failed to keep the country safe. And they got really smart people to leave their egos at the door and spend 6 months and say, what do we need to do to keep the country safe? I would hope, whether it's Biden or Trump, that that's the kind of mentality. Because for us to think that either party has the answer, they haven't. The Affordable Care Act really just gave a lot more people access to a broken, fragmented, expensive, and inequitable healthcare system. And that's why you're seeing so many more people of color and people that are poorer, both getting COVID and dying of COVID. That's not because they're more susceptible. There's no genetic predisposition to RNA encapsulated viruses. It's just that literally they have a greater prevalence of asthma, diabetes, obesity, hypertension, which happen to be risk factors for COVID. So I think all the social determinants of health that we talk about, I think it's now life and death. And I'm hoping that we can actually look at things very differently.
There is a long due reckoning with a lot of facts about healthcare, for sure.
Yeah, yeah,
Um,
and nobody's had the answer to this point.
yeah, yeah.